Hello everyone, I am Dr. Siddhartha, consultant interventional cardiologist at Tagore Hospital, Mukundapur, Kolkata. Today I will be discussing on a very important topic which bothers many of our patients, that is regarding use of blood thinners or anticoagulants. Now blood thinners are a group of medicines which medically we term as anticoagulants, which prevent blood clotting. So we prescribe this group of medicines in patients having artificial heart valves or sometimes other artificial heart devices that can be metallic devices or sometimes tissue devices as well, and in certain patients where there is increased risk of stroke, particularly patients having high irregular heart rate, that is called atrial fibrillation, sometimes in patients having stroke, suffering from cardioembolic stroke, sometimes in patients with peripheral arterial disease, that is blockage in the arteries of arms or legs. Sometimes following heart attacks we sometimes find LV clots, clots in the cardiac chambers. So in those patients sometimes we use these blood thinners. So there are many group of patients who get these anticoagulants or blood thinners. Now blood thinners previously used were called vitamin K antagonists, that is Warfarin group of drugs. Now these drugs had many restrictions in their dietary restrictions or drug restrictions while the patient is on those vitamin K antagonists. Now those patients who get warfarin, they have to follow a stringent diet, and that is my main point of discussion today. See, those patients who are getting this warfarin group of drugs, the primary thing they have to avoid is green leafy vegetables, or a green part of the vegetables. So those vegetables which are particularly green as a whole, or those vegetables which have a thick green outside coating or outside husk, so those vegetables have to be avoided. Like you can say spinach or lettuce or those leafy vegetables. Now they are completely green, you cannot remove the green parts from their surface, so they have to be strictly avoided. Next comes vegetables like rich gourd or gourd or parvars, where there is a outside green part and the inside part of the vegetable is whitish or yellowish. So in those vegetables you have to remove a thick coating from the surface, and the inner part, the inner vegetable portion you can consume. Next is some of the vegetables like ladyfinger, those vegetables are completely green. So beans, so again this is impossible, or this is not possible to remove the green part and take the other consumable portion. So you have to completely stop taking these vegetables in your diet. So remember, any vegetable you find green, or any portion of the vegetable you find green in color, you have to avoid that. Next thing, you have to avoid certain vegetable oils like the palm oils, the olive oils, they are very harmful. You have to avoid certain fruits like we avoid mangoes, pomegranate, certain fruits, they can alter your INR levels. That is why we advise to restrict your fruit intake also. You should avoid soybeans, that is again very important. You have to avoid caffeine products, coffee or chocolates. You have to avoid muttons or beefs, that is meat of higher or bigger animals. You can take lean meat of chicken, that is only you can take safely, but not in a high quantity. You should not consume too much of meat at a time. So these are certain restrictions regarding your diet. So you have to concentrate on the cereal products more, the wheat or rice products, you can consume the dairy products, you can consume vegetables which are not green in color, you can consume among fruits, you can safely consume banana, which contains, which do not interfere too much with the drug. Now along with these different dietary restrictions, you have to be careful about consuming other medicines as well, because there are many group of medicines which interfere with the functioning of these warfarin group of drugs, like antifungals, like different antibiotics, like even some antacids, which are commonly taken in over the counter, like the patient feels acidity, goes to the medicine shop and takes an antacid. That can also interfere with the functioning of these blood thinners. Now these blood thinners, why are they so important? Because they prevent blood clotting inside your heart. Now whenever you have a metallic valve, or whenever you have a particular arrhythmia like atrial fibrillation, there is a tendency of the blood to clot inside your heart. Now if the effect of these medicines are decreased by intake of improper foods or improper medicines, then what will happen is you can have clot formation inside your heart, or in some cases you can have bleeding. So because these are blood thinners, they always have a high risk of bleeding as a side effect. So that is why strict maintenance of your diet after consultation with your cardiologist should be followed. I will enumerate a list of foods that are unsafe and foods that are safe at the end of my video. You can note them down. Next important precaution is, whenever a patient is taking blood thinners, they have an increased risk of bleeding from any part of the body. So that is a thing you have to carefully monitor. First of all, you have to avoid injuries or traumas. Even minor traumas can lead to hematomas or bleeding spots over your body, but they are less harmful. The more harmful things is intracranial bleeding, that is bleeding inside your brain, or bleeding in your urine, bleeding in your stool. So you have to always be carefully looking for any red discoloration or bleeding in your urine, in your stool. You have to look for gum bleeding, you have to look for bleeding from nose or any other sites, or you have to look for bleeding spots or ecchymotic spots over the body. So that is very important. If you find any such bleeding manifestations, immediately stop that medicine, immediately consult your cardiologist and act accordingly. And also you have to avoid injuries, as I said, because minor injuries or needle pricks that can produce hematomas or continuous bleedings. So in such patients, taking injections or taking vaccine is again very risky. That can lead to muscle hematomas if you take intramuscular injections or vaccines. So that is why you have to previously inform your doctor before taking any injection or vaccines, and you have to take proper precautions. We often monitor the effect of these medicines by INR testing. So this is a blood testing which is advised every month, or maybe even more frequent in certain situations, and it has to be strictly followed. I often find patients forgetting to do this monthly investigation once they are stable and once they are symptom free. So they tend to forget, but that should not be done, because this INR can drastically vary. Maybe you are having a stable INR for many months, and then suddenly you stop doing it, checking it every month, and you find you land up in an abnormal INR, and that can lead to strokes or bleedings. So these are the few precautions. Diet I mentioned, the medicines, avoiding injury, looking for bleeding manifestation, doing regular INR or blood testing as advised. Next comes during pregnancy. This is harmful for the fetus. So if a female patient is on this group of medicines and they have a chance to get pregnant, so you have to carefully look for your pregnancy, and if detected if detected positive, then you have to change this group of medicines as per consultation of your cardiologists and gynecologists, and you have to adjust the doses accordingly. And lastly, I would mention that recently, in the last few years, we have got a new group of medicines which are called NOACs, this is a medical terminology, novel oral anticoagulants. So these are again blood thinners, but they are completely different. Their mechanism of action is completely different from these previous group of vitamin K antagonist or warfarin group of medicine. Now if most of our cases or patients who are previously on this warfarin group of drugs are now being shifted to this new group of medicines, that is the NOACs. With NOACs you have minimum dietary interference, so you need not follow the dietary restrictions, you need not do monthly INR, you need not follow strict it does not interfere with other medicines too much, so you need not think too much while taking another antibiotic or antacid or something. So that is again a sense of relief, a big relief, and you need not do the monthly test that saves the money and saves the harassment of the patients. They are more or less effective, even more effective than warfarin group of medicines, and they are sometimes they are safe as well. So but this change from previous old group of medicines to the newer generation medicines should be strictly monitored and advised only by your doctors or cardiologists, because certain situations demand only the previous warfarin group of medicines. It is not a blanket prescription that every patient can be shifted from the old group of medicines to the new ones. There are certain diseases like patients having tissue valves or something, in certain situations we cannot change them to the new group of medicines. So they will follow, they will continue with warfarin group of drugs, and in those situations you have to strictly follow the precautions I have described or enumerated. So this is a very effective group of medicine as well as very dangerous group of medicines that can lead to complications. So please do not take it casually. Whenever you are on blood thinners, you have to be strictly in touch with your doctor, and you have to strictly monitor for your own symptoms.
Another important thing, before any surgical procedures or dental extractions, you often need to stop these medicines for 4-5 days, monitor INR, and in that period and in that overlapping period you have to use some other injectable medicines like heparins or other group of medicines, and then you have to perform the surgical procedure. After finishing that, you can again shift back to these oral medicines. So this period should be strictly monitored by your cardiologists. It's best to get admitted under a hospital care in this intervening period and accordingly adjust the dosage, because without stopping these medicines you can have unnecessary extra bleeding during the surgical procedures.
Thank you.